Welcome to Obesity Chronicles, a novel perspective. My name is Robert Kushner, and I'm a professor of medicine and medical education at Northwestern University Feinberg School of Medicine at Northwestern Medicine in Chicago. This program is intended for healthcare professionals. The information presented in this podcast is aligned with the views and opinions of the speakers and is sponsored by Novo Nordisk. The speakers have been compensated by Novo Nordisk for their participation in this program. This podcast is not to be used as medical advice and is intended for educational purposes only. It is not approved for continuing medical education credits. In today's podcast, we'll be talking about obesity and social determinants of health. And I will be joined by colleagues Dr. Rethink Hunt and Michael Knight. Rethink, would you please introduce yourself to our audience?
Sure, Bob. My name is Rethink Hunt, and I am Medical Director at Princeton Medicine Weight Management Program, Internal Medicine Faculty at Penn Medicine, Princeton Medicine Physicians, and Clinical Assistant Professor of Medicine at Rutgers Robert Wood Johnson Medical School.
And Michael?
Yes, happy to be here. My name is Michael Knight. I am Clinical Associate Professor of Medicine at the George Washington University School of Medicine and Health Sciences and an attending physician in the Weight Management Clinic at the GW Medical Faculty Associates.
I am thrilled to be joined by both of you. Before we begin discussing the social determinants of health for obesity, I want to provide a brief background on the state of obesity. We all know that obesity is a major public health crisis in the United States. The number of adults with overweight and obesity continues to rise. Additionally, obesity and overweight are associated with non-communicable diseases like hypertension, hypercholesterolemia, type 2 diabetes, cardiovascular disease, and some forms of cancer. In addition, obesity and the comorbidities associated with obesity put a financial strain on the healthcare system and on individual patients who are living with the disease. There's been some attention placed on public health and prevention of obesity for